Healthcare and essential workers on the front lines are pleading for more protective equipment in the battle against COVID-19. The president of the American Medical Association saying in a statement, quote, "At this critical moment, a unified effort is urgently needed to identify gaps in the supply and lack of access to PPE or personal protective equipment necessary to fight COVID-19. The AMA continues to urge the administration to ensure manufacturing of PPE is operating at maximum possible capacity and create a national tracking system of acquisition and distribution of critical PPE supplies." Joining me now is Ernest Grant, the president of the American Nurses Association, which represents and advocates for the country's 4 million registered nurses, and Dr. Lipi Roy, an internal medicine physician and an MSNBC medical contributor. Welcome to both of you. Ernest, let me just start with you. Your people are on the absolute front lines of this. It becomes confusing to people like us about where it is you're supposed to get your supplies, and when there aren't enough supplies, what is it you're supposed to do about it? Because we've heard about nurses and doctors reusing their personal protective equipment, trying to sanitize them, using things that are supposed to be single use, not just for one use, and going into some situations not fully protected.
Yes, the American Nurses Association has strongly advocated for the proper use of personal protective equipment, not only the N95 masks, but also the face shields, the plastic gowns or the plastic jumpsuits that you see, individuals wearing on TV clips. It's extremely important that the healthcare personnel have these, and so that they're not putting themselves at risk or also their family members at risk as well.
I want to put up a map, Dr. Roy, to just sort of show where this illness is going in the United States. Right now, absolutely, the epicenter is right here, the New York, New Jersey, Connecticut area, and you see a lot of hot spots around there. But you can see in Florida, a place that sort of seemed to be in denial about having it a couple of weeks ago. They got hot spots there. New Orleans is an emerging hot spot. It's actually got a higher mortality rate than New York does right now. Detroit, Chicago, and a lot of places in the Midwest, as well as Seattle and spots on the West Coast. The problems that we are seeing here in New York, Dr. Roy, with supplies and equipment and staffing are simply going to repeat themselves across the country, and I still haven't heard of anything that sounds like a coordinated national strategy for the acquisition of supplies and equipment.
Good morning, Ali. So I'm going to try to be as clear and concise as possible. The need for basic essential equipment for doctors and nurses is still severely lacking. The need remains high, I should say. Doctors and nurses and other healthcare workers are risking their lives for the public. And remember, it takes years to train these highly specialized medical personnel. A lot of my colleagues are really referring to this as a World War III, except that it's doctors and nurses who are on the front lines battling without ammunition. And remember, burnout was high before COVID-19 amongst clinicians and physicians and healthcare workers. It's just going to skyrocket. And burnout isn't just stress, right? It's emotional and physical exhaustion, depersonalization, and it's associated with a lot of negative consequences. It's associated with poor medical quality, associated with increase in medical errors and increase in addiction, alcoholism, depression, and suicide. I'm an addiction medicine doctor. This is what I see. I can't even fathom what I'm going to be seeing while this pandemic progresses. And you mentioned some of the other hotspots, emerging hotspots. As a country, our healthcare system is not prepared to handle multiple hotspots simultaneously. New Orleans, where I was a medical student and evacuated from Hurricane Katrina, and I remember very well the mental health consequences that are still lasting. I mean, the hospitality industry, which is, I think, the #1 source of tourism in New Orleans, it's shut down. And so remember, these environmental stressors have an adverse impact on chronic medical conditions and psychological conditions. So we really need to be aware of all of these issues and take a multidisciplinary, aggressive approach, because lives are at stake, and it's going to take a long time for the healthcare system to recover from all of this.
Ernest, what is the issue you're most hearing from the nurses? Is it the burnout? Is it the isolation? Is it the lack of support? Is it the lack of equipment? Is it the fear that they themselves are going to get sick? What's the issue that you want most clearly addressed?
The top concern that the American Nurses Association is hearing from nurses is the fact that they are concerned about the lack of the PPEs. They also feel that they are not prepared, to care for these patients. They're not aware or fully aware of the disaster preparedness programs that the different healthcare facilities have. So they need to be educated on that. What is their role? What is expected of them so that they can provide the best care possible? And of course, there's some other things as well, as you mentioned, the stress, the working the very long hours, and also, the mere fact that some of their colleagues are catching this virus as well, which also puts that person out of the workforce, and it means that more people are having to, to care for the individuals while their colleague is on the mend, or the fact that their colleagues may also have to self-isolate because of the fact that they were working near that individual.
We're grateful to the nurses. Ernest, please let them know. President of the American Nurses Association, Ernest Grant. And, of course, we are grateful to the doctors, MSNBC medical contributor Dr. Lipi Roy, for keeping us posted, and those working on the front lines to keep us healthy. Thank you.